Hi, welcome to Bult for Life. I am Garrett Bult, actor, personal trainer, former powerlifter, pro wrestler, and chronic pain thriver. Bult for Life is a podcast about living with the challenges of chronic pain. Our goal is to acknowledge, inspire, and relate to people living with chronic pain. I believe it is not only possible to survive, but to live a full life and thrive with chronic pain. No matter where you are in your journey, our mission is to give you the information and inspiration that will help you become Bult for Life. Hey guys, Garrett Bult here. I'm really excited. Special guest today, my wife, my person, my soulmate, Beth. She's an incredibly gifted mind. She graduated from Columbia University with honors. She's worked in emergency rooms and hospitals all over Manhattan. She was on duty the day of 9/11. She's worked with Dr. Oz at Columbia Presbyterian with heart failure patients. She's worked in functional medicine. On top of that, she's also been a figure pro. She's competed at a national level in women's physique competitions. She's won 2 women's bench press competitions, and she gave birth to our beautiful big-headed child. And with that, I introduce my lovely wife, Beth.
Hi.
Hi, baby.
Hiya.
Welcome to the show.
Thank you. Very happy to be here. I sound really good on paper. I like that.
Really good in person, if I may say so.
Thank you. Thank you for that intro.
So why don't you tell everybody a little bit about yourself and what you're passionate about?
As you stated, I am a family nurse practitioner. I've been doing that for about 13 years now. And before that, I was an RN for about 10 years. And it's been quite an amazing journey. I love what I do. I love all of the things that I've done, some more than others. But I have a passion for helping people, which actually got started before I went to nursing school because my dad, he was sick for a while, and I used to be his caregiver when he was in the hospital. And he had kidney failure, and he never took great care of himself. I used to go to see him in the hospital every day. 3 months before he passed away, he was in the hospital. He was in the hospital for 3 months. And one of the things he said to me, which, I never forgot, when I was putting lotion on his back, he said to me, I had just started nursing school, so he said, I hope you are as good to your patients as you are to me. And I'll never forget that. And so being involved with him in the hospital and helping him really kind of sparked my passion for the medical field and for helping people. And that has helped me, I believe, really to have that empathy and that gift for people when I see them there in the hospital or when they're sick and suffering. So my journey began there, and it's been incredible. I worked in med-surg for a while, and then I found the emergency room, which was wonderful. Busy, so much fun. Worked with some great people and really had a chance to make a difference, and then decided to go back to school to become a family nurse practitioner. And then as I was doing that, got involved in heart failure and did that for a while as a nurse practitioner, end-stage heart failure patients, and then cardiac surgery with patients who, were waiting for transplants. And then at some point around that time, I started having a passion I started working out. I loved it, and I loved to put the hard work in and see the results. And then I also began realizing how important nutrition was. And so then with that sparked this whole nother direction where I really started to realize how important nutrition was. I became interested in integrative medicine, functional medicine from that point on, and started doing competitions, figure and physique competitions for the next several years. And it's really sparked my passion for how important nutrition is. And the journey has sort of led me really to combine the two. And so today, as you know, we are so passionate about being active and leading a healthy lifestyle. And what I've come to realize over the past several years is how important it is, that link between chronic illness and nutrition. I'm so passionate about helping people to realize that they can make so many changes in their health, so many, through just making changes in their lifestyle, and for the most part their diet, but also their activity, and not to mention the mindset, which goes along with that too. But yeah, so I kind of bring that to the table now with what I do with my current position as a nurse practitioner. And I see so many patients with chronic illness because there's so much of that now. And we have a lot of really sick people. And sometimes I just want to shake them and just say, just change this one thing today. Just stop drinking this soda, or just take the sugar out of your diet, and try to explain to them on a pretty basic level the importance of that, and how, what we put in really makes a big impact. Speaking of sugar, for instance, and how detrimental that is to our health, and how much it is linked with inflammation, how important inflammation is in almost every disease process, not to mention diabetes, which, pretty much makes everything worse. That brings me to the one thing I love to tell the patients about health, which health is on this continuum. And so we're always moving in one direction or another. And depending on every decision we make every day, every choice is going to move us in one direction or another. If I choose to take a bite of this donut today, it's going to push me in the direction of poorer health, leading towards, illness, diabetes, and disease, versus I'm going to put that donut down. I'm going to take a bite of this, I'm going to have some blueberries. It's going to move you in the other direction, it's never static. And that's one of the things I like to share with my patients, to really help them to get a sense of understanding how every single choice we make is going to help get us to where we want to be.
Yeah.
That was a long answer.
No, it's great. I love it, And I mean, I've been the fortunate recipient of your experience and your strength. And I know Dad would be proud, and I see the way you care for your patients. And,
thank you.
I've been so fortunate to have you in my life and all your experience. And that's why we want to share it with everybody on the podcast, is that those changes, I love, I know I was pretty stubborn, didn't want to make a lot of changes. And it's tough, when you feel like your body's betraying you. I felt like, I've given up this, I've given up that. I don't want to give this up. And I love what you said, is that I can add something to it, or I can make this one change. And it's the little small changes. If I stay in today, what can I do today? Not jump ahead to tomorrow, or not jump ahead to what I used to do, but stay in the day and make those small changes. They really add up.
They do. I think that's the only way it really works or lasts, because I see so many people who then just want to do, all right, I'm going to change everything today. I'm going to give up all of this, and I'm going to start eating only salads, and, very unrealistic goals,
right.
And just too big and overwhelming, and it doesn't last. And so that's where that one little change today. And then, tomorrow I'll make another decision to change one thing and stick with that for a while. And then after a couple of weeks, let me revisit this and see, well, what else can I change today? I believe that when people really do that, are able to just make that little change and keep going, instead of feeling like they don't have control over their bodies or whatever's going on, it's very empowering,
Absolutely.
Because they are making that choice, and they know that choice is a positive choice, and hopefully to help them to understand that is leading them in a direction that they want to be in, where they can thrive and achieve their goals. There's so many things that we can't control that occur. And so of the things that we can control, there are many, and so putting the right things in, it is so important. And a lot of people don't really make that connection, but it's basically, it's crucial. Eating good foods, not eating junk, not eating processed foods. And, a lot of people are very sensitive to dairy and gluten and don't realize it. And so, if they can manage to just take some of those things out of their diet and see how they feel, and, be diligent about it, and to see if there's any change in how they feel, at least just try it. And I know it's really challenging for a lot of people, first of all, just to accept, to try to make the change, or even to make that connection that food can be, in any way contributing to anything. But I always try, I never tell anybody what they need to do or should do, but I try to gently suggest that, what's it going to hurt to try this? Because if it does help, then great, without having to have more complications or add another medication. And, there's no side effects to try and just clean up your diet by just taking a lot of the junk out, processed foods, fast foods, sugar, things like that. And so that's the first thing, because without proper nutrition, I truly believe, that's the foundation. And without that, a lot of times we're just spinning our wheels.
And, I can say, and the challenge for me is, first of all, you're in pain, so your cortisol levels go up, and you want to eat junk food. You want to eat sugar. My thing is sugar, carbs, and that was a big challenge. I like, though, one of the things that you suggested to me, to change my diet was not to first take away something, but add something in that was good. And I think like an example would be, I didn't necessarily take out the dairy at first, but I tried almond milk. And I'm like, almond milk's pretty good. It's flavored. And I added that. And for a while, I was doing almond milk and milk. But then eventually it's like, well, hey, you know what? I could just do almond milk. And that started, and I'm not 100% off dairy even now, but I eat a lot less of it. I consume a lot less of it. So I like that idea of, because first of all, I mean, for me, being in chronic pain, it feels like everything is a struggle, and it's a struggle just to hang on to any little thing, you know? So the idea of taking something away seems even more, you know, I've like, pain's already taken away my time. Pain's already taken away, you know, my ability to do this. And then, so now you're taking away this. So I like that idea of adding something too. And then for me, that was, and small steps, you know, like you suggested.
I know it's so challenging because there's also the control part of it, you know, I mean, like, I know early on when we got together, it was like, I would try to tell you what you needed to do. And I have since learned that does not work. Used to be very good at telling people what how they should do things.
Well, it's kind of your job in a way.
Yeah, in a way. But I've learned a different way now. Sometimes I just need to bite my tongue or lead by example. That's the other thing, you know, and just kind of be patient. I know it's really, really hard to make changes when you're feeling really, really lousy. The comfort of eating and just doing what you want, you know, eating good foods, eating sugar or whatever, is who wants to give that up? And like a patient I just saw earlier today was extremely frustrating because she was so consumed by her disease and her pain, and to make any suggestion for her to change one thing would have been, I mean, it definitely would have fallen on deaf ears, you know. I think that it's really important to just kind of try to meet people where they are at that moment and see, you know, is there one little thing today, just one thing, even small, that you can just change, tiny.
Yeah.
I mean, you know, you've learned that. And just creating a new habit of making a change or making a decision to change something. And instead of looking at it as like giving something up or a painful change, if we could try to help people to look at it as taking control, you know, instead of giving that up. Your body is completely out of your control and betraying you when you're in pain or when you're sick.
One of the biggest things for me to replace was bread. I had a really tough time giving up bread. And what we did was, Beth suggested that I try rice cakes, which you may now regret because I eat almost nothing but rice cakes.
I want them off the rice cakes.
I have a tendency to overdo things. You'd never guess that, right, from knowing my story. So I said, well, why don't you try these? I think you even bought them, and they were the good flavored ones. You know, now when she buys them for me, she buys me the plain ones, you know, with no flavor. But the first ones were free, you know. But honestly, I tried the rice cakes. I liked them, and before you knew it, I had this great alternative to bread that I had not previously thought of, and now I don't eat bread. Occasionally gluten-free bread, but that was a big step in getting me to a gluten-free diet. And it's great to see it will be 10 years that we met. It's great to kind of look back over our relationship and my chronic issues and chronic pain, and to see how our health has evolved over that time and the changes that we've made. And then with the addition of our son, who just turned 6, and his dietary needs and wanting a gluten-free diet for him for medical reasons, and that being a motivator for us to make the changes, you know. But it didn't, like you said, it didn't happen all at once. It's been a very gradual change, and I hope that we continue to keep evolving as we learn more and we find more things, and hopefully growing and thriving.
And I think really important to have an open mind too, and to suggestions, because I can be a little stubborn and pig-headed sometimes too.
You?
So not a conversation not that long ago about making sure we always, every now and then, reevaluate what we're doing to make sure that it's still what we want, and it's still that we still agree with it together and individually, and to make sure that we're hopefully on the right track for what we're trying to achieve.
Right, because things change.
Yeah, and we can never know for sure, but we try to get as much information as we can and make the best decisions.
Absolutely.
And if you're not okay with that, then that's something that I need to accept and be open-minded to, that, you know, it's not always my way. And sometimes it takes time to accept certain things.
Sure. And, I can remember a time where before we had Jake, and we were able to try a lot of different things. And I kind of got to the point where not everything works. And I really got to a point where it's like, I just can't try another thing right now because it might not work. You remember that? And that was a challenging time, but a little bit of time and patience and open-mindedness, eventually I became a little more receptive.
Do you mean with foods or supplements?
Foods, and we had also at some point had tried a couple different treatments when you were working at the functional medicine practice.
Right.
We had tried the machine.
Right, the PEMF.
The PEMF machine, which was a great opportunity, but it was just, there were certain things, well, we'll try this. This didn't work. I'll try that. This didn't work. And then I was just like, I don't want to try anything. I've had it. It might not work. And that was kind of a challenging time, but I feel like we've come to a better, more even pace. More recently with acupuncture, you suggested acupuncture, and well, our neighbor has an acupuncture practice, so that's something that,
suggested it 9 years ago.
What did you say? Patience and
I know. Well,
open-minded?
this is that's what I've learned. It's, I have to be. It's patience. Well, it's been such a journey for me too to really look at myself and see, how am I presenting this? And first of all, I may think that I know what's best, and I might be wrong. So I need, and that's something that I've learned. Yeah, I said might. That's something that actually has been a big lesson for me, because I still tend to feel like I know what I know. I know certain things, and I believe certain things to be true. But that doesn't mean it's either the right thing for this person, you, or patients.
Yeah.
Or it could be, but it's not right at this time.
Right.
Because if someone's not, like I learned with with us. If you're not open and ready, it doesn't matter how good the treatment or the decision is, because it's not going to work, because first of all, you're not invested in it, you don't believe in it, and so therefore you're not going to follow through. So it has to be the right time, and no one can make someone ready.
Right.
That has to come from that person. So that's been a really big lesson for me that I've learned, and I believe that. And so that's something that us together has taught me and helped me bring to my patients, the patients suffering with chronic pain or chronic disease. Or also then if I sometimes speak to the caregivers regarding, the loved one that's suffering, to try to remind them gently that, we can only do so much, and you can only make so many suggestions, and it's got to be on that person's time, and that's hard, because you just want to get in there and, this is what you have to do, and this is when you have to do it, and it's going to fix you,
Right.
But doesn't work that way.
I've heard it said that the caregivers and the loved ones of people with chronic pain go through they suffer the same as the person with the pain without the physical pain, but the emotional and the mental pain can be just as bad. Do you think that's true?
Oh, absolutely. Because you're as close to that person as you, aside from me feeling the pain as you do, I'm probably the closest person, the person who understands the most of what you're going through. And yet there's nothing I can do about it as far as fixing it. When we first met, we first got married, and this started to become an issue, and you were diagnosed with RSD, it was so difficult for me to accept that I couldn't fix it. And I still struggle with that today, as you know. But I was, there were days where I just couldn't stop researching and trying to figure things out, and I just couldn't accept that I couldn't fix it for you. So yeah, I think it's definitely is extremely challenging, and there's so much. I mean, gosh, it's so important for me every day to remember that you're the one dealing with the pain. And then that's the big challenge that comes in with caretakers, is how do I not get so consumed by that I forget about what I need? The trick is to not forget yourself, to not forget about taking care of yourself. To remember that you are your own person, and to not get totally consumed by the pain.
Do you see that with your patients, and when you talk to people with chronic pain and you deal with that?
With their caregivers.
Yeah.
Yeah, absolutely. Any chronic condition, the caretakers, I try to remember what I've been told and what I try to do for myself, and share that with them. So, things that I've learned along the way and been told, and that I work on every day, to remember to get out with friends, take care of yourself. Remember what you love to do. Remember who you are.
Right.
Remember what makes you happy. And one of the biggest things that I remember learned from one of the therapists that I had seen years ago in some counseling was to remember to do the things that fill me back up. Because as a caregiver, you're always giving and giving. And, when the well runs dry, you have nothing left to give. And then what happens? I see it in my patients all the time. And I've seen, little bits in myself every now and then, or at least going in that direction, becoming bitter and resentful and angry and frustrated and impatient. And it's a huge red flag that I need to step away and readjust what I've been doing. Remember to just take, even if it's 5 or 10 minutes, just to go for a walk, get outside, read a book, the things that make me happy.
I think a big part of our story and issues, we have our 6-year-old son, Jake, who's amazing. And how do you feel the chronic pain has affected our family dynamic?
Oh, gosh. You've never asked me that question before,
It's interesting. I thought about it, and we deal with it on a daily basis. We make adjustments. We, I have my limitations. We have our responsibilities and limitations, and it's a huge challenge, and the silver lining of all my surgeries and my limitations is that I have been able to stay home with Jake in a lot of situations, and I have been able to be a caregiver to him and help to raise him and be more a part of that. And obviously the downside is I'm so limited in the things I can do, and I have to plot out. I have to manage my time. I have to manage my energies. Now he's getting older. He's getting involved in martial arts, which was one of my loves, but I'm limited in how much I can do with him. I'm grateful that I can still do some things, but I definitely feel that. And I feel really fortunate that he has a really athletic mother who's really able to kind of take up some of the slack, that I feel. It's things that I would want to do with them.
Thank you.
But I feel that that's been such a huge thing for us to balance and use those tools to be able to get the most out of what we have, right? It's a lot about management.
Absolutely. And I think one of the things that is so important to me is to remember that how I deal with the situation and acceptance of your chronic pain and limitations is really important because he's watching everything we do.
I think it's great that he now has an understanding. We've had to keep it at his level so he understands where I'm at, and now he knows, especially with my recent surgery, okay, he has more of an understanding. Daddy had a back surgery. He can't do this because of his back, and Daddy used to do this, but now he can only do this. And, I think that's been really useful in keeping him at his level involved and not trying to just ignore it or push it out of it or pretend like things are normal, which is what I want to do. I don't want to have to say, my back hurts, I can't do this, or I'm limited, I need to rest.
We're teaching him how to handle adversity. I mean, there's always a silver lining, and there's always, focusing on the positives that come out of it, right? That's how we've been living this.
One of the great things that we've done is we've sought out therapy, and we have a great therapist. And, I love what she came up with, the idea of it's almost like there's a third person in the relationship, and, with our son, it's like it's almost like there's another person in the family, and that's the chronic pain. And it's...
I have to correct you.
Yes.
This is the wife in me. I came up with that because for the longest time I felt that pain was that other person in our relationship.
Yeah.
And I get very angry at that person because they get right in the middle and right in the way. And I can't reach you on an emotional level sometimes. And that's really hard. Anyway, with that being said.
Yeah, I give you due credit. You did come up with that idea, and the therapist kind of stole it from me.
She has to give me credit with that. She's going to use it. Oh, the name.
Yeah. So we named it Ed. So that seemed like a pretty good name.
So FH.
FH for short.
So keep it clean.
You don't necessarily get a break from it. There might be good days and bad days, but it's always there. It's that, like you said, that third person in the relationship,
I think because it tends to be kind of isolating and hard to talk about because you feel like no one really understands it.
Yeah.
I mean, I'm sure you feel that way.
Yeah. And
dealing with the pain, going through this together. I've remember when you were starting the support group?
Yeah.
And I was
Chronic
thinking
pain
how
support group.
right. I was thinking how great it would be to have a support group for caregivers.
Yeah,
Which,
absolutely.
it's something that we maybe down the road can pursue.
I think it's a great idea to have support for the people that give support and the people that are caregivers and loved ones.
Knowing that there are other people out there
Yeah,
that are going through the same thing.
yeah. And, that's why we love the format of the podcast because, as you know, anybody with chronic pain has the hardest time. That was the biggest challenge we had with the support group was getting people to show up. I mean, try getting any three people, healthy people together at one place at the same time every week or every month. It's pretty challenging. And then try getting a group of people with chronic pain together. And I imagine the same issue with people that are caregivers. They're always on duty or they're always working or they're always coming home to this or there's that. So, yeah, I mean, we're really fortunate with this great medium with the podcast, and we can connect to social media. We can connect to our webpage. We can connect to a lot of different formats and hopefully really get people involved and sharing what works for them and what doesn't work for them,
If you're a loved one of someone who's dealing with chronic pain or has just been diagnosed with chronic pain, I would say one of the most important things to remember is that they're really going to need your love and support more than anything. But you have to remember to step away from it and live your life and do the things that make you happy. Get out and make sure you connect with other people who are not in pain. You've got to step away from it sometimes. And that way, when you come back, you're fresher and you're able to give more, because there are going to be days when you're going to want them to give to you and they can't because they're just trying to get through the day. And if you can try to not take that personally and remember how much they love you and need you and want you by their side, and there will be brighter days, I think that will be just invaluable. You don't lose yourself in that person and don't lose yourself in that situation because it may be a long journey. I think that's just really one of the most important things I can pass on to someone, to you.
That's great. That's great advice.
I hope that if there's people out there dealing with chronic pain or chronic illness that are in a relationship, that we can find something we can really help them to see, that at least share with them what we've learned, because I don't know the percentage, but we know that it is really difficult for people in relationships with someone with chronic pain. I mean, there are a lot of, again, I don't know the percentage, but a lot of the relationships, they dissolve.
Yep. We know several
high
stories
percentage.
personally.
High percentage, because it's not easy. And so I hope that we can, through our struggles and our triumphs and our tough times, we can, share that with people, because it's definitely, they've been really challenging times.
Absolutely. But we're still here.
We are.
Got to keep going.
Yeah.
Keep moving forward.
We learn so much about each other and about ourselves too,
Absolutely.
And stronger for it.
Absolutely. Oh, it's so great having you here. Thank you so much for sharing just a little bit of what we've been through, and we're just barely scratching the surface. So thank you so much.
Oh, thank you so much for having me. Looking forward to coming back and sharing more of what we've learned along the way and seeing how else we can help people who deal with what we deal with. This has been wonderful. Thank you.
Well, I want to thank again my wife, Beth, for being on the Bult for Life podcast. I mean, it was a really great opportunity to talk about a relationship and some of the things that we've learned along the way. And it was great to hear her experience about how she's learned to take care of herself so that she then has more to give to me and to my son. And I can't wait to have her back on the show. And if you know anybody that's living with someone in pain or someone that's living with pain and they need help or they found something that helps, we'd love to hear from you guys. You could reach out to us at bultforlife.com. You can find us on Instagram. You can find us on Facebook, the Bult for Life podcast, YouTube, anywhere that you can reach out to us. We'd love to hear from you. And just remember, you don't have to do this alone, whether you're living with chronic pain or you live with someone with chronic pain. And that's what the Bult for Life podcast is all about, is sharing and relating and helping one another. Our goal is to help you or anyone that you might know to live and thrive with chronic pain. And you can help us out by subscribing or giving us a review on iTunes or anywhere else that you hear Bult for Life. On the next episode of the Bult for Life podcast, we will have Billy and Kim from Rebel Hot Yoga. It was so great to meet them and get to know more about their story and what they do and what they've been through. If you're looking for something to do, an activity, a way to help deal with your chronic pain, this is a must listen. Thanks again. This is Garrett Bult for Bult for Life.